You're tuned into the AdvoSci Health podcast. We're here to talk about rare diseases, real people, and the ripple effects of change. Stories that move you, guests who challenge the norm, and vibes that keep it real.
Hello, everyone, and welcome back to the ASH podcast. Today, we are honored to be joined by Dr. Zafar Zaidi, CEO of the Indus Hospital and Health Network and Dean of Indus University of Health Sciences. Dr. Zaidi has been instrumental in building one of Pakistan's largest, completely free healthcare systems, a network that spans tertiary hospitals, primary care programs, nursing education, and they're now growing a medical university as well, so that would be great to see in Pakistan. This is hopefully to expand access to high quality healthcare at a free cost to all individuals, and then those who can pay are recommended to do so. So today we'll talk about Indus's global partnerships, maybe some of the new initiatives that are happening, the vision for the next decade, and anything else that we can learn about sort of their project. So thank you, Dr. Zaidi, for being here.
Thank you for asking me to be on this program.
Of course. I think, well, so just to anyone who's listening, Dr. Zaidi did do a TedTalk very recently. I believe it was on the 25th of December of 2025. So very new. And he talked about the entire history of the Indus Health Network, how it began, what they have accomplished. We will link that here. So we're not going to ask him to go too deep into the history, but we would like to know maybe if you could explain maybe a little bit about what makes Indus unique and some of the projects that are currently progressing at Indus.
What makes Indus unique is that it started off as a small hospital, grew into a network, and all the functions that we do there are absolutely free of cost to the patient, be it outpatient, inpatient, whatever needs to be done, for which we collect funds ourselves, and we manage to treat patients who are the poor, marginalized ones who can't afford it, and try to give them very good quality. What makes Indus unique is that 20 years ago when we were building all of this, and 18 years ago when we started off with a paperless environment, which is software that we had built ourselves and is running still, and has managed to connect the whole network together and keep everything digitalized and on our toes, and we are ready to see what's happening wherever, and everything is there. Something which is unique in that part of the world, in a lower middle income country in Karachi in Pakistan, and in the region as well, even for that matter in the Western Hemisphere, being completely paperless is something which is recent and not so far back as 18 years. So and what makes Indus unique is that it has decided that it's going to try and change the ecosystem of healthcare in Pakistan. So we have ventured out, not in starting with a small hospital, building into a tertiary hospital, connecting it with primary care, but also trying to provide training and education in health sector, as you just mentioned, so that we can have an overall impact on the health delivery in Pakistan and try and improve the systems over there. So I think the multiple areas that gives us an edge over many other centers which are trying to work in the same field.
Yeah, that's very true. I think especially your point about being paperless from such an early on aspect. Yeah. I think Omar, you have a slightly more experience than me, but how many hospitals here have we seen with like not being paperless?
I think there are quite a few here in Ontario that still try with paper, but now we have like our EMR systems here. So they try to circulate that and improve that. But I know that they're not always on the same page. They have different EMR systems between hospitals. So I'm wondering if Dr. Zaidi, in Pakistan, did you notice that if there are some hospitals that are still more favoring paper, how has that disconnect guided you to perhaps convincing them as well to start using paperless systems?
Well, it's not some few hospitals. Most of them are still on the archival paper system, and as a result, it's a hard task trying to convince them to come to the digital era and be all paperless. Very few of them are. And as you just mentioned, just like anywhere else in the world, unless it is an initiative by the government where they have provided the software to everyone, if it is a private initiative just like ours, you do have fragmented health medical records across the country where people have their own systems and many of them don't talk to each other. So yes, that also is a big problem. But I think with digitalization, which has crept in so much into our daily life, forget about the health. There is a desire and the efficiency that has shown in terms of both record keeping and management, and in being able to predict and to see trends and analyze and work on healthcare, and which is the strength of the systems. And I think that's also one of the unique parts of Indus, that has a very strong systems and the analysis that we do and use it for both our patients and ourselves in terms of healthcare. That is something which is now catching on, and most places are now thinking, if they have not already started thinking, then they're thinking that that's the direction they're going to take. And I see that. I think the very heavy investure that used to happen in digitalization, in making systems paperless, that is changing. Software is coming cheaper, applications now on the fly available. So all of that is going to change, where and young people who are very keen to develop all of these, it's going to change a lot. And I think in the times to come, there will be much more demand from the patients, from those who are being cared for, that they should be able to do that. And I'm one of those who are proponent, who feel that the medical record, which is the basis of what we're talking at the moment, is the property of the patient. So somehow or the other, even though they have come to the hospital and we keep their record and we keep everything, aligned with that, it should be access should be available to the patient, where they at their own will use it wherever they want to use it. So it's going to change. It's going to change in a major way, and I see in 5 years' time there'll be a very major shift in there.
Yeah, 100%. I think that's so true, especially since we're in like a day and age where digitalization is not even just in healthcare, it's in like all parts of life.
Yeah.
So, and especially since patients are also linked through social media and stuff, they can see the Western world and other countries with other healthcare systems, how they've integrated and sort of built that accessibility. So, patients naturally, like, in low income countries may want the same. So that makes a
But
lot of sense.
having said that, the level of education, the level of computer literacy or IT ability in low income countries is very low. Yet I feel that we should not aim for the lowest cadre who can't do all of this, but we
Yeah.
should aim for a better level and try and bring everybody up to that.
Yes.
Absolutely.
Yeah.
I 100% agree. And with respect to Indus itself, I know that they've emphasized primary care, tertiary care, and rehabilitation. So, how are you deciding where to invest next within this healthcare sector?
Yeah, that's a good question. I think because we are based on collecting donation, our funding is based on donations and zakat and all of that we collect and spend on our patients, as well as both private sector being in partnership with us in some places, like corporate social responsibilities of institutions, as well as the government through its private-public partnership. I think the need remains everywhere. But what we have also learned is that we're not going to dive in and do large tertiary care hospitals everywhere. Our grand plan, which has a much longer sort of a strategic life that's going to take place, is to have one large tertiary care training hospital in every province of Pakistan, link it through a hub and spoke model through our primary care, where it's not unique. It's something which happens in a lot of places, and try and build that up. So we will take on options where we have the opportunity to, where the funding is available either through the government sector or some private donations, because that's the most important thing. We cannot keep expanding without being committed funding for that expanse. So so that's how it's going to be. I think the areas which are going to focus heavily for the Indus Hospital and Health Network in the probably in the next 5 years and then the whole decade would be very much be research. And research would be more like public health research, as well as being able to answer problems of our own contextual problems in our own health system. That would be something that we would very much concentrate on. Building the human resources, because we have also learned that when you have the right human resources, somehow the funds do come and you can build things. But without the right human resources, without the people who are championing that idea or thing, it is, it may just remain a desire or a dream of a few, and it doesn't become, it doesn't translate into reality. So yes, in more on that. But in terms of where we would be more focused in terms of expansion, I think we have also in the late realized that there are a lot of areas in the Pakistan health system that can be improved piecemeal. You don't have to do the whole hospital, and somebody can do that, and that's not a wrong thing to do. But you can also work purely, for instance, on infection control, on patient care in terms of nursing, in terms of patient flows in the way they come in and go and whatever, and supply chain and in the financial management of things. So we would be happy, and we would be willing and wanting to help out wherever we can, where we are just providing a certain small percentage of the whole care for the patient in a setup, but it improves as things go along, because it's both a momentum that is created for change and for improvement, and it is also a benchmark where people can see that if there's an improvement, there are results attached to it as well.
Absolutely.
So wherever we'll get the chance, we'll go.
Yeah, I think that's the best way. Especially, I love the idea of trying to build a tertiary hospital in every province, because that's definitely something that will help a lot. And then, yes, with small improvements here and there, I think would do so much more than people thinking just building a hospital can accomplish. But your point about human resources, I think, was very important, which actually leads me to wanting to know about when it comes to training, whether it be nurses, doctors, other hospital staff, etc. Do you think that training these individuals inside a system like Indus, that is a free care system, might shape how they practice medicine later on in their lives? And does that benefit it?
Yes, I think there is a difference. I think when people are working where it is not linked to their performance remuneration, and it is linked to their performance in terms of quality and care, so their focus changes. They're not focused on how to be able to make their ends meet and find funds for themselves, but more on what services that they can offer. So yes, I think it does change to whatever extent. Now, whether they can continue that concept and feeling when they go into a pure private cutthroat system wherever it be in the world, it's not easy. But I think being our a lot of our emphasis is on the training, is not just on the educating or their knowledge building, but a lot more on the skills and to some extent on the attitude as well, because I think that is the bit which seems to be absent in a lot of the educational system which is available across the world, where there's a huge emphasis on knowledge. In fact, I feel there's an overload of knowledge, very minimal amount of skills being transferred, and absolutely nothing done towards the attitude, which is going to play a major role. Now, you and I could be both doctors of the same caliber, and if your attitude is far better than mine, you will get better results. I may be better at doing surgery, but you will get better results because the patients will listen to you. You will have an empathetic approach to the patient, so you will take care of their other needs, which are just staring in your face medical problem. and which is, of course, is an important thing as well. So I think the overall training does matter. I think the atmosphere, the environment that they work in does matter. I think because medicine is so much linked with humanism. It's not just a mechanical engineering where you fix two nuts and bolts and it's done. No, it's a lot more. It's, after all, is the human body that you're and a human being that you're talking to.
Absolutely. I think we see that so much everywhere in the world, where there's doctors, surgeons, etc., that don't have the best attitude when they interact with patients, and maybe it comes from how they've trained or where they have been trained and the environment that they've been pushed in. Because when you,
I think the environment matters, as well as the workload, the pressures and the pressure of delivering. So a lot of things matter, and I think as overall, not just in this, but overall, if you look at it, we are probably maybe missing that the thought that this needs to be put in place and this needs to be given attention to.
Yes, I agree as well, because I feel like this applies so much to so many other countries as well. Like even just living in Canada and seeing our healthcare system, the environment is like so different between different hospitals, let alone a whole like province on its own, and that does wonders to the demographics that they serve. And that's why so many people jump between cities just to go to different hospitals, because they can sense that their environment is not welcoming, or that training has not passed on to build that trust with the patient. So with respect to that, I was wondering, like, when we're thinking about Indus as a global health model and just looking at other global health institutions, in your opinion, what do global health institutions tend to get wrong when they look at healthcare systems in the global south?
That's a difficult question for me to answer, because I am in the south. I'm not in the, So I think what I feel, a lot of my colleagues who are abroad have a more of a condescending attitude towards south to a large extent. We know it and you don't know it. We in the south do know our problems. We are not naive to them. We know our limitations. We know what our strengths, our weaknesses are. We may not have the funds to do some of the things, but there's a difference. So the attitude of some of the global institutions to parachute in, fix a problem and parachute out doesn't help. It doesn't help. I mean, it is until and unless they are engaged in the long run. And again, what is it that they are trying to achieve? If it is a photo opportunity, they will get it. Will it be of benefit to the South? Probably not. But if it was to, change and sort of a transfer of knowledge or transfer of things, and as well as learning from each other, if that attitude is brought in, then it works much better.
Absolutely. I think that's so true, not even just in healthcare, but in generally, the rest of the world sees the global south and just instantly has that perception of, we will tell you what is wrong with you. Like, yes, we know. We may not be able to fix it right away, but trust us, we know we're living in it. So that is...
I fear that it is not the north-south, but even in south-south. Even in certain parts of the country, if I go there, I may have a very arrogant attitude, because I feel that they may not have that capacity, because they can't do this or they don't have that. But it doesn't mean that they don't have the understanding, or they can't feel it and they can't understand it, and they're not intellectual enough to understand what it is. They may not have the resources to deal with it, but that's separate to being able to comprehend the problem.
Absolutely. And slightly shifting a bit, because we've been talking about how Indus deals with like a bit about global partnerships and how you talked about your colleagues. As you mentioned, Indus is based mostly on funding given by donors, zakat, etc. And a lot of this comes from international organizations and abroad as well, outside of Pakistan. So going slightly into the economic aspect of Indus, when you have this funding coming in, how do you balance the international funding and collaboration while keeping the system locally accountable for those funds and also how they're used properly in respect to maybe the political conditions of Pakistan or the way that Indus is organized?
Okay, so being totally apolitical, we are not, we're neither not to date, and hopefully never in future. We've never been pressurized into using funds for any particular means or whatever. So that takes care of the external component of it.
Okay.
When it comes to the internal component of it, we are very cognizant of the fact that a lot of the funds that we raise are zakat, and as a religious understanding, that we will be questioned for how it has been used. When I say question, it is question afterlife, how it has been used properly, and were we honest about it. So we are conscious of it. We are that element and a lot of the religiosity that comes with it. We are very conscious of it. So we have done all things which would be required in any other organization, wherever it be in the world, to remain totally transparent. For instance, all our funding that comes in and all our expenses, they're audited by third parties, and the audited accounts are published on the web, because we are registered with the Securities Exchange of Pakistan. So it's everything is over there for anybody, as transparently as they want to see. And we are accountable, so we have to ensure that we are also cost efficient, and since we are cost conscious of things, because it's others' money, and we continue to both study, research, as well as question the cost that we are incurring on various things, and trying to find either more cost, I wouldn't say cheaper, because that gives you the feeling that you're cutting on something, but more cost efficient ways of doing things, and that's a constant. But at every time and everywhere, we have tried to remain as transparent as possible, so that it is for our own learning. And I think one of the biggest achievements Indus has done is it's earned a name of respect, being transparent and being fair, and being able to provide care without any discrimination. So that has been the thing. So just like anywhere else, we are open to all sorts of auditing. We are open, and we do, irrespective of whether there is no current trend in Pakistan to publish all your things like your KPIs or XYZ. As a result, there are no forums to do that. If they were, we would be happy to do that as well.
Absolutely, and I think that's very important to recognize as well, like this form of transparency, because I feel like especially people who live abroad, or even like from the country as well, they tend to connect the healthcare system in any parts of the country to politics. I feel like this is like a huge thing, and that creates the misconception that it's all like tied together, and that they have a vetted interest in working out with a political agenda. So you making that very transparent is actually really good to hear, actually, because that builds more trust for anyone listening as well, and also it allows us to understand that we're serving the people, and transparency is like the number one priority when you run the system. And just coming to sort of like a close, as we're talking about just the future of Indus itself, I'm wondering, when you think like 10 to 20 years ahead, what does success for Indus actually look like? I know it's a very broad question, but like in your vision.
I think I refer you, if you guys have not read that book called Tipping Point by Malcolm Gladwell, where you create a certain amount of momentum where things start happening. And I feel if we can create a certain amount of momentum in changing or improving the ecosystem of health in Pakistan, where it becomes the right thing to do, that would be the real success. We may not be doing it, others are doing it, but they are doing it because they got the inspiration from us, or we have trailblazed, or we have showed them the way, or we have the systems that we have shared with them, or given them the insight that it is possible to do a lot of healthcare in cost effectively in a good way and efficiently. I think that would be success. It will not. I feel currently, like we have across the country over 2,500 beds in various hospitals combined. That may go up to 10,000, or may go to 5,000 or 8. So I think that, yes, that would be an achievement, but the real achievement is that we become inspirational for others to do better.
I think absolutely that would be an amazing achievement, and I would look at that book now, because I think that's maybe something we could use as well.
Yeah.
This is slightly a different question, but because of what you've achieved with Indus, what your plans are hopefully in the future, and the fact that it keeps growing, I want to know, if you were to start Indus today, either in Pakistan or somewhere else in a different country, whether that be similar lower middle income country, or maybe some like a higher income country, what is the first thing you would look for when trying to start this initiative?
That's a difficult question, Ali, because when we started, we had no clue where we will reach today, where we have. So there was a lot of energy, there was a lot of desire, motivation, and we were much younger, so that was another major thing. With so many years of nearly 20 years of experience behind you, start looking at things in a more granular and a micro fashion. That will this be right? Will that be right? I think I would be looking at where the need is. I would be looking at where there is a desire by the community to improve themselves. Until and unless the people who are going to support you, they also want that or are willing to do that, it will be the same as we talked about. It will be like going to another country, trying to parachute in, do something and say, oh, we've done this, and come out. Will it be sustainable? It will only be sustainable if the local people, if the local are really involved in it. So without a great buy-in, without the agency being transferred to the local people and with them, wherever it be, whether in Pakistan, maybe I've learned that as well, that, like the way we are working in Balochistan, without the local people. And then again, it took a while before the mass became so many that the whole neighborhood or whole society or a whole city started to own it, that we were having trouble initially, difficulty. There were a lot of people against us, but with time that improved to the point where now they own it, and that is so much easier now to run it. The same would apply to any other place, wherever it be.
Of course, I think that's absolutely right. You can't do it without the locals. You can't do it without the people you're trying to help. So first, I think, thank you so much for all the answers, everything you've talked about, and what you've done with Indus, and hopefully it keeps to grow. This does bring us to the end of today's episode. Again, a sincere thank you to you, Dr. Zaidi, for sharing your insights, your vision for the future of Indus as a network, as a hospital, as also maybe a medical school that is being worked on, from expanding access to healthcare, high quality healthcare, and especially free healthcare. To all of our listeners, if you enjoyed this conversation, please do also check out the TED Talk that Dr. Zaidi gave. We will link it in the description. Please, I don't know, if you'd like this episode, share it so other people can hear it, and there's more people talking about these innovations, more conversations happening about healthcare, so that we can hopefully fix a lot of the healthcare systems that are broken in the world. Thank you all for listening, and we'll see you next time.